Hi, I'm Beth Allen. I am very proud to be an ambassador for the New Zealand Gynaecological Cancer Foundation, an organisation devoted to helping women understand the symptoms of cancer of the reproductive organs. In New Zealand, one woman dies every day from a gynaecological cancer. By sharing the stories of several amazing women with you today, I hope you will stop for a moment and reflect on your own gynaecological health. To tell you more about the four main types of gynaecological cancers and their symptoms, here is one of New Zealand's leading gynaecological oncologists, Dr. Zealand Gynaecological.
Gynaecological cancer involves cancer of the women's reproductive part, cancer of the ovaries, there's 2 ovaries, one on each side, cancer of the womb, which specifically I'm talking about the lining of the womb called the endometrium, cancer of the neck of the womb, which is the cervix, we'll call that cervical cancer, and last but not least, the vulvar cancer, which is on the external genitalia of the woman.
Fiona and Carol are 2 remarkable women who've each had a gynaecological cancer. Fiona, cervical cancer, and Carol, ovarian cancer. For US resident Carol Nelson, cancer was the last thing on her mind when she came home to Gisborne for Christmas.
Always been active, always enjoyed being outside. Being in Gisborne, I think you just learn to, do things like that.
Another woman who thought she was too healthy to get ill is professional rower Fiona Patterson.
There's been a lot of highlights with my rowing career, but I'd say probably world champion, under 23 world champion in 2004 in the quad in Poland was probably a highlight. I didn't have a GP, I had a sports doctor, and so sort of only went to him when I had an injury or something that kept me out of the boat. As far as sort of small things go, I was quite prone to ignoring them and just letting things go. So that's how my cervical cancer went undetected for quite a while. I was aware that something was wrong because I was bleeding irregularly, quite heavily towards the end before diagnosis. I was just so immersed in my training, and I thought that when you train hard you can lose your period, and I thought that, well, if you're training hard maybe you can just get it more often as well. So I ignored the symptoms for a while. I was also extremely fatigued, beyond what was normal for an athlete. It wasn't until it got to a sort of dire point that I eventually took myself to a doctor.
The gynaecologist in America gave me a range of tests, one being vaginal ultrasound and the other being a CA125 blood test. The vaginal ultrasound revealed the tumour, and the CA125 blood results confirmed that they suspected it to be ovarian cancer. No time was wasted. I was then referred on to a gynaecologist-oncologist, and from there on, things moved very fast.
During the examination, a piece of the tumour came off, and that got sent away to get tested. Came back, and it was, I was diagnosed with clear cell cervical cancer, which is a rare aggressive type of cervical cancer. And that, it was a bit of a shock at the time, being 22 and diagnosed with a rare aggressive cervical cancer. Well, the operation went really well. I had a node dissection, and the cancer hadn't spread to any of my lymph nodes, which was really positive. But because it was such an aggressive type of cancer, I had to have radiation and chemotherapy.
I was up about in the hospital really quickly. My surgeon told me I was fit and healthy, and he told me I would be up and about in no time. Usually went down to see the babies down in the maternity ward and look at them and hope that one day I would be doing the same at one of my grandchildren. And it was rather lovely to see the start of a new life with things that were happening to me. So it gave me the inspiration to get out of the hospital and get going, and there was things to do and things to see. And
cancer didn't make me feel like any less of a woman, like having a hysterectomy. It is a big part of who you are, but you can either sit around and dwell on it or just get on with it. I mean, to look at me, you probably wouldn't know that anything had happened. And that's kind of how I like it.
Dr. Zealand Gynaecological will now sum up the most common signs and symptoms of gynaecological cancer.
The symptoms of ovarian cancer are bloating, and what I mean by that is abdominal bloating, abdominal and pelvic pain, feeling full quite easily after you've eaten, and urinary symptoms, sometimes like frequency, going a lot, or feeling pressure in your bladder. Now, not all the symptoms mean you have cancer, but obviously if the symptoms persist and they're severe enough for more than 4 weeks, then you should consult your doctor. Endometrial cancer is the most common gynecological cancer, and a majority of women that have endometrial cancer are postmenopausal. Any woman who's gone through the menopause and has bleeding, that is abnormal. The next cancer that I'd like to talk about is cervical cancer. And as we all know, cervical cancer has a screening program, and that has worked very successfully in New Zealand in picking up precursors of cervical cancer. Vulvar cancer involves 5% of all gynecological cancers, and 90% of vulvar cancers present with itchiness around the vulva and a lump. There's a variety of treatments available. Usually they involve surgery, radiotherapy, chemotherapy, or a combination of all those three. Early detection obviously increases someone's survival rates. The important message for women is that if they have symptoms and the symptoms persist, then they should seek medical advice.
And now to talk about some important issues for Māori and Pacific Island women is Hinurewa Te Hau.
I ngā mana, i ngā reo, i ngā iwi, i ngā tōpito i whā, tēnā rā koutou, tēnā rā koutou, tēnā rā koutou katoa. Ngā mihi nui ki a koutou, e mana wahine, ki a kaha. Nō reira, tēnā rā koutou, tēnā rā koutou, tēnā rā koutou katoa. Every year, as a percentage of population, there are more Māori and Pacific Island women diagnosed with gynecological cancer than Pākehā women. This has been addressed in part by the Ministry of Health Cervical Screening Program, but it is up to us to prevent other forms of gynecological cancer. Get regular checkups, be aware of any changes to your body, don't be shy, go see a doctor. It could save your life. It saved mine.
For ovarian cancer, the BEAT acronym is a great way to remember the common symptoms. B is for bloating that is persistent and doesn't come and go. E is for eating, if you have difficulty eating and feel full more quickly. A is for abdominal and pelvic pain that you feel most days. And T is for talking to your doctor. And remember, bleeding after sex or bleeding after menopause is not normal and needs to be checked out by a doctor. And remember also that in New Zealand, on average, 1 woman dies from a gynecological cancer every day. Ovarian cancer is the 4th biggest killer of New Zealand women, with 1 woman dying every 48 hours from ovarian cancer. If you would like more information about the foundation, go to our website www.nzgcf.org.nz. Your valuable support is vital for us to continue to educate New Zealand women and to significantly reduce the incidence of gynecological cancer. Thank you.